So let me tell you, I can't think of a better word. I guess I'm thrilled to be introducing this next panel. I think one of the things, as both the Department of Mental Health and the Department of Alcohol and Drug Programs disappeared over the last couple of years and moved into the Department of Healthcare Services, there was both good things and bad things about that. But one of the things that most of us worried about was the lack of really explicit knowledge about mental health and substance use disorders within the Department of Healthcare Services. So this panel represents a big change, and I'm very excited about it because now we have a team of people who are working in the Division of Mental Health and Substance Use Disorders at DHCS who have a wealth of knowledge and bring all the information to that work that we all believe is so incredibly important. So I'm going to introduce folks here, and I don't know what order you're going to speak in, but...
We don't either.
Okay, however you do it, it's fine with me. So let me tell you a little bit about each of these folks. Brenda Grayish is now the Chief of the Office of Mental Health. And Brenda actually started her career at the Department of Mental Health in 1999 at the state. She worked there until 2009, and when she left, she was the chief of the Office of Performance Outcomes and Quality Improvement Unit. So great experience there. And from there, she went on to the Department of Corrections, where she served, her last job there was as Deputy Director of the Office of Research at the Department of Corrections. So then, cleverly enough, DHCS brought her back to DHCS to work there, and she's now the Chief of the Mental Health Services Division. So I asked each of these folks, what do you like to do for fun? Because, you know, we hear all about their professional lives. And what Brenda told me is that she has two little ones, 5 and 6, so that's her fun. And any of you who've raised little kids, you know if you're working full-time and you have 2 small children, there is no time left. Then Marjorie McKisson also was with the Department of Drug and Alcohol Programs for quite a long time, over 20 years, and she served in a variety of different positions there. She, just a few of them, she worked in fiscal policy, drug Medi-Cal, she worked with a block grant, and she's worked with policy. So she's got a whole variety of kinds of experiences in substance use disorders, which we are really absolutely delighted to have her here. She's the Assistant Chief for Substance Use Disorders Prevention, Treatment, and Recovery Services. And they usually rattle that off in a bunch of initials, and I didn't even know what it was at first, but I learned. Then we also have Rida Mccabe, who many of you probably knew working at the Department of Mental Health for a long time. And I knew her, you may have had other positions there, but I've known Rita mostly as working in Medicaid. And I will tell you, I am so pleased that she's now working in Medi-Cal, Medicaid, at the Department of Healthcare Services, because she brings a whole history and knowledge of how that system works. Another policy issue that's been sorely lacking, but now we see fulfilled. And then last but not least, of course, I want to introduce Dr. Karen Baylor, who a few of you may know. She is the former director of San Luis Obispo, the behavioral health director there, comes with both experience in mental health and substance use disorders. She's also been the president of CMHDA, so you have no doubt known her in that way as well. She started her work in children's services in private nonprofits, so I was kind of glad to hear that because she's had the experience working in nonprofits as well as in government. So I asked again, what do you like to do for fun? Oh, I forgot to mention Marjorie McKisson's fun thing, cooking.
Ooh,
so,
wow, good to know.
So if you want to have a big dinner sometime, apparently she's the person to call on. So I asked Karen, so what do you like to do for fun? And she said, well, she's a gym rat, and she likes to read, but the thing that probably most of you know about her, and that I certainly know about her, and I'm sure all of you do, she loves to shop. She is a shopping maniac. And if you ever look at her shoes, she loves to shop for shoes. Every time I see Karen, the first thing I do is I look at her shoes because I know they're going to be fun. So I'm going to turn this over to you all.
Thank you.
Thank you.
So I tried to consult with my speechwriter, Roland, last night. Where is he? So if this thing bombs terribly, put that on your evaluation, please. That was Alan's fault. First of all, I want to thank Sandra so much for the invite. When I first got this position, I was asked by a couple of you, are you going to make it to the policy forum? And I have no idea how travel works in state government. And Sandra made it happen, so thank you very much for that. I don't think I've missed a policy forum in the last 8 years, and I mean, come on, coming to San Diego. So I really want to thank you for the opportunity. And then to bring the team along, I was happy that Marlies Perez was able to come on board and join us. So I want the opportunity for you all to meet the team and to be able to share issues and problems that we're all facing and see if we can't start forming a collaborative working relationship and a partnership. But I really do believe that we are stronger together, and I think we can accomplish more when we are together. I understand that there will be differences, and we can do that without being disagreeable with each other. And I really do think that mental health and substance use disorders have gotten a lot of attention over the years, and now is the time to really move the field forward. And the state can't do it alone, the counties can't do it alone, the providers can't do it alone, the advocates can't do it alone. But think of what we could do if we do it together. So those of you who know me know that I'm not really good with the political speak. I'm pretty direct and honest. I promise to you I will always tell you the truth. If I know something but am not allowed to tell you, I will tell you that as well. We were talking last night about integrity and how important that moral compass is, and I've really learned that a lot from Pat Ryan, so thank you for that. And I'm still really irritated she's leaving, but don't tell her that. So I just think that it's time to form partnerships and to work on all these issues together, and I'm excited about that opportunity. So the agenda this morning is a little different. Some of this information you already know. There's still a lot of things we don't know yet and haven't figured out yet. But my goal for the presentation this morning is just for you all to get a feel for who we are and to start the conversations and start working together on these issues. And then to hear from you. I'm hoping we have time for questions and issues that you can bring up that we need to be aware of that maybe we're not. And just to have the opportunity to build these relationships. Brenda is, for those of you who don't know, she's kind of this data, what is the word? Diva. Oh, I like that.
Oh, I like that. That's great.
So that is such a plus when we talk about outcome measures. Rita's been around forever. I'm sorry, that's really inappropriate, isn't it? But we all know Rita and has a wealth of information, so we're excited about that. But Marjorie's very, very knowledgeable and been in substance use disorders. And Marlies I've just gotten to know, and you'll see when she talks why she's up here and why some of you will be her new best friend. So as we talk about provider enrollment and all of those fun things. So there is a lot we don't know. I don't mean to frustrate you when you ask me questions and I'll say, I don't know. But as we go along on this path, we will figure things out together, and I'm excited at that opportunity. So just briefly wanted to say, again, week 3. We have, I think you all know that we have reorganized. We've taken ADP and DMH and merged them into this one big entity. which was a lot of the back of the house kinds of stuff that you never got to see, but was pretty painful at times, I think would be a fair assessment. On my first day I was hearing we don't have codes for paper, and we don't, we can't order supplies, and we can't, so there was a lot of that infrastructure pieces that had to get built. But I think things have settled down a little bit. And then the remaining portions of ADP just got transferred over, so there's been a lot of work. But have any of you seen Michael Cunningham's old office? Impressive. They tried to get me to move over there. It's very enticing, and why did he retire? He's got a couch. It was lovely. So anyway, many of you know Roland Ives, who has been around in mental health for a lot of years too. This was his slide. He just thought this was really important, and to know that we're up against changes. And then someone was telling me, you know what the ACA really stands for, right? Another change again? So here we go. I know you've all seen this, but I really want you to try and embrace how large of a department DHCS is. They employ more people than my former county. That's how big this place is. And we are on this the right-hand side, but we've got some infrastructure now, and so we're excited about being able to move things forward. But in county land, I'm used to running down to my boss's office and saying, hey, can we do X, Y, Z? And he makes a call and we make it happen. This is a tad bit more complicated. So I just really wanted you to know that, and as I try to learn and navigate the state system, it's a pretty large system, and the acronyms alone I heard were 85 pages, and I said, no thank you. I'll just learn by osmosis, I think. So just wanted you to know there's a lot of moving parts and a lot of components, but I'm very appreciative of the fact that I report right to Toby, so that he really has learned over the last couple of years really the importance of mental health and substance use disorders, and is aware of all the issues we're facing. And then I'm going to turn this over and let each one of my folks talk about their own divisions, so that you get a sense of who to call for what and when, because I'm still learning that. But I'm going to go ahead and turn this over. Do you guys want to sit there? You want to come up here? What do you want to do?
Yeah, we can share.
Huh? Best to go to the podium. Okay, Alice says come here.
Okay. I think it's mental health first.
That's me.
Yeah, so is this you?
Yeah. We'll figure it out.
Hi, thank you so much for having us all here today. We're really excited to have an opportunity to be here and to, for me, meet everybody. Karen knows most of you here, and I think actually everyone else on the panel does. I've been away from mental health for a few years, so there are some new faces, but I'm very excited to have a chance and another opportunity to get to work closely with each of you. Looking at my branch, and actually I think you have my slide because I can't see that well. That's one other part of getting a little older and can't see that well. I have 3 branches that report to me. One is the policy, and I'm on week 6 here, so just to kind of set that caveat out as well. The program policy quality assurance branch with Dina Cocos-Gonzalez as the branch chief. My second branch that reports to me is the fiscal oversight and I think it's outcomes unit. Is that branch actually? And that's headed by Gary Renslow. And actually my old unit is now under that. I used to be in the performance outcomes and quality improvement unit, which was led by Stephanie Operdeck when I left DMH. So I know some of you folks just from working in that area. So, and then the third branch that reports to me is the Lynette Castleman's branch, the Program Oversight and Compliance branch. So those three branches, I'm still getting to know them, each of them. My expertise is in outcomes. So I'll put the other caveat out there, or the request out there, to be patient with me while I learn. And I'm very eager and excited to learn about each of the different branches. I kind of feel like we're a little bit of a phoenix rising from the ashes. A lot of changes, and with the budget reductions over the years, I'm coming from corrections and rehabilitation. I've been in budget reduction mode for quite a few years now, and I think mental health was going through the same, all the departments were going through the same budget reductions. And so, during that time, even though we had a shrinking workforce, we still were expected to do just as much work, if not more. And, trying to keep up with all of the needs and the priorities has been challenging, but it's very exciting now with the Affordable Care Act coming up very soon that we'll be able to expand. So it's a really fun and exciting time to get to work on these exciting projects. So I think with that, and I'm not sure how to use this, Karen, is this just the...
Yes.
Okay. That's the other thing, when you have kids, you lose track of technology and all things that are modern. So with that, I'll go ahead and let Marjorie come up. Thank you.
Thank you. Good morning. So Dave Nielsen, my boss, who is the, Division Chief for the new Substance Use Disorders Prevention, Treatment, and Recovery Services now that's been integrated into the Department of Healthcare Services. He sends his regrets that he cannot be here today and asked me to be here for you. As you know, the Drug Medi-Cal program transferred to DHCS last year. This year, the remaining functions and responsibilities of the Department of Alcohol and Drug Programs transferred to DHCS in July. What that means is that we kind of shuffled ourselves twice for Drug Medi-Cal, and now we are re-merged with our counterparts that came from alcohol and drug programs with the block grant, etc. And so now we're back kind of configured mostly the way we had been before, but within the Department of Healthcare Services. So all of the staff that you have long-standing relationships with and contact phone numbers and emails, they are still there. Their phone numbers are the same. Their email address has changed. It's changed to the Department of Healthcare Services, so their extension's different. But some of the key things that the new Division of Substance Use Disorders Prevention, Treatment, and Recovery Services covers, we still continue with the continuum of services within that division. We cover prevention. We have a resource center that is still open in Sacramento. It's up on our website. It's up in our DHCS website. We have technical assistance contracts. We do the program policy, the fiscal policy, not only for Drug Medi-Cal, but also with the block grant. We do also the Office of Statewide Planning is and County Monitoring is within this division. That state planning unit does the annual planning for the, now I used to say for the department, but for the division. And it includes a wealth of information as to the services and providers within counties, what's happening with those services, how people are doing. Our new division that's been reconfigured also now includes the Office of Applied Research and Analysis, so we're getting even more greater depth to the information that we work on and prepare for counties. This division provides a lot of support to counties, contracts, cost reports, Drug Medi-Cal claims, but also a lot of county outcome information. Your county analyst will continue to work with you directly for those in the counties, as well as when you have requests for us, we will be there for you. So again, same people, same phone numbers, different email address. Thank you. I'm going to introduce Marlies Perez, who's the acting division chief for the Substance Use Disorders Compliance Division.
Thank you. I would like to start off by saying this is my 628th week here. Marjorie she saw what I was doing, and she was going to calculate her 20 years. I said, you can't do that. You're going to steal my line. So I wasn't introduced because I just came at the last minute, just kind of sliding in to come to the policy forum. But I'm really excited to be here. And what I like to do for fun is I'm actually on the side. I write romance novels. So some of you that don't know that about me, there's a little tickler about me. I don't really have a lot of time to do that right now with this job, but it is a passion of mine. It's just kind of my stress outlet. So our division, am I on the right slide? Nope. Let's see. It's a big green button. There we go. I look so small. We have 3 branches in our division, so we are SUD compliance. And so my first branch is the licensing and certification branch, and that is where we license and certify our facilities. It's pretty basic. We license AOD residential facilities and also certify them. We also certify outpatient facilities for AOD in this branch, and we also currently hold the drug Medi-Cal certification piece. Then my next branch is the DUI, NTP, and criminal justice branch, which is pretty self-explanatory, but we do all of our DUI services, our narcotic treatment program services there. That's where we license those facilities. And then the criminal justice programs ranges the gamut for working on things with the counties with AB 109. We still have issues with Prop 36. We also have our parolee services network and drug courts. So that's quite a mesh of different criminal justice programs that we have some sort of participation with. And then the third branch is complaints and counselor certification. And once again, very self-explanatory, but that's where we intake all the complaints on any of our facilities. So our website has been transferred from ADP over to DHCS. There's the infamous 1-800 line for anybody that can call, whether it be a client, a family member, counselor, you folks that can file a complaint, and we will then investigate that complaint, whether it be on one of our facilities or also our counselors. So for those of you that aren't on the SUD side of the house, I thought it might be helpful. I'm on a big education campaign. Like Karen spoke about, we went from a small little bowl at ADP into this huge department, and so what I'm doing is I'm taking advantage. So every opportunity I can, I speak about substance use services. Every meeting I'm at, this is who we are, this is what we do, because I want them to learn about us. I'm inviting them out to our facilities, come see us, come to our meetings, get to know us, because I feel like this is a tremendous opportunity to blend in and just take them over. So, wish me luck. But with that, I'm going to start with some of you mental health folks. So with our facilities, we have approximately 802 licensed residential facilities, non-medical currently. We also have 245 licensed residential detox facilities. We have 506 AOD, alcohol and other drugs certified. These are our outpatient facilities, which that certification is voluntary. We also have 148 NTP, so that's narcotic treatment program licenses, and then we have 488 driving under the influence program licenses. So that's kind of gives you a little bit of a feel for some of the facilities and the numbers. In these facilities, on the AOD side of the house, we service approximately about over 200,000 clients annually. In our DUI programs, we service 150,000 clients annually. And then we have approximately 36,000 registered and certified counselors in our field. So what is my vision? I have been with the department for about 12 years. I actually came in when Prop 36 passed, so I'm a Prop 36 baby. So just the sentiments that were echoed earlier about the criminal justice population, that is huge in our field. So I really have a passion for those clients in particular. But one thing that I have been striving to do, especially in licensing and certification over the last few years, is to really strengthen accountability. The department has some robust statutory and regulatory authority, and I believe in implementing that because I believe in removing the bad apples brings the better apples to surface, and then you're going to have better services for clients. So some of you may not know me, which is a good thing, because if I'm at your facility, that's usually not good. So you really don't want to see me at your facility unless I call and say, just really want to do a dog and pony show. Otherwise, I'm out there and I'm enforcing. You may see me in court. I just take it all the way because I believe that we should be protecting the client, and I take that extremely seriously. So we have been revoking licenses over the last few years in all of our programs. But we also are giving out new ones too, so I give and take. But I think that the accountability, and my goal is to strengthen that even more so through our internal processes, and also working with our mental health partners and seeing how they do enforcement and accountability on their side of the house, and see how we can strengthen that partnership together. Another thing that I'm really focused on is, and I was just talking to Brett and John back before this started, but is integrating our DUI system into our treatment system. I firmly believe that they're the first door of entry, and we were talking a lot about that. These folks, some of them are just there, yeah, they made a mistake, but others are there because they have issues with substance use. And so this is their first access to treatment. And so we need to do a better job at the state and county level in integrating them into our system of care. So that's a really big goal of mine. Also, I want to work, since I'm in charge of the counselors, but is strengthening the partnerships that we have with our 6 certifying bodies, but also looking in overall, how can we strengthen our workforce and what can we do? I know we have the workforce development report. How do we implement some of those suggestions, and how do we move that forward? I have a really, it's been rough at times, the transition, but at the same time, even though we've been super busy, one thing that I've made a commitment to, and my staff know not even to ask me about, is our stakeholders. So if I'm in charge of 3 advisory groups, and we are having those meetings. I don't care what else is going on. I believe we can't make the decisions by ourselves, because if we do, they're not going to be the right decisions. So I'm really honoring the times that we have with our stakeholders and making sure that we consistently have our meetings. I'm in charge of the DUI advisory group, the NTP advisory group, and also counselor certification. So if you're part of those groups, I would just encourage you just to dive right in. We really have some really great things going, and my goal is to continue those. And last but not least, and I think most important, is the reason why we are together, this group here as a division, is to really integrate and learn. And I'm very excited. I've already had some discussions with Brenda of just cross-training. How do you do the licensing certification in mental health? How do you do it in substance use? And really bringing that together, because I think if we really model that at the state level, then in the providers that aren't currently integrated, that can just span out, and we can bring the best practices, because we get the bird's eye view, so we get to see what everybody's doing, and you folks don't always get that. You get your one piece. But so if we can take that look and then bring it together, I think that's going to help improve the access and just services in general. Thank you.